Here, at the 96 Medical Group on Eglin Air Force Base, we're dedicated to patient safety. To mark Patient Safety Awareness Week 2023, here are some highlights of practices and processes from our own personnel.
Welcome to the 96 Medical Group Blood Transfusion Services. We supply the medical group with all the blood they need for surgeries, for labor and delivery, for babies, and we just want to make sure that you get a safe product. And one of the ways that we do that is when you come to the lab, we're going to ask you to state your name, your date of birth. We're going to verify your DOD identification number and your ID card. And we're going to make sure that when we collect that blood that it is you and that we are able to give you this product.
Some of the important safety solutions that we implement in our MTF are hand washing and mask wearing. Hand washing is done between patient care and after touching a patient's skin. Mask wearing is done when in close proximity of a patient and when in public areas of the MTF.
Hi, I'm Sergeant Perry and I work in public health. The most common patient safety identifier that we use in public health clinic is the patient identification. So when a patient comes to public health, we make sure that we have the right patient for their hearing test or another exam that they're coming in to see us for. We are going to ask them for their full name, date of birth, and also their DOD number to make sure that we have the right patient before they're seen by one of our technicians.
Good morning, I'm Staff Sergeant Laredo. I'm at MCLIC of Inpatient Pharmacy. What we do here is we process all orders for the multiple clinics and units throughout the hospital. We receive orders, double-check the patient's information, weight, and dosing. This allows us to cross-check and effectively and efficiently get all patients their accurate medication. We receive the orders from the providers, and then we make it here in our AFT room. Once it leaves here, it gets checked again by a pharmacist, and this helps us to make sure that we give every patient the accurate and safe medication throughout the facility.
As a surgery scheduler, patient safety doesn't just begin in the OR. It starts here. Being kind, making sure they're confident, and make sure that they have instructions that they need to get there, to be prepared. So patient safety is not just in the OR with our providers and our nurses who are just excellent staff, but it also starts here with making sure that they have the instructions to be prepared for that day.
My patient safety heroes are the ICU telemetry techs. As an ICU charge nurse, I couldn't do my job without them. They have a lot of responsibility for young airmen. They get a lot of training and use a lot of critical thinking on a day-to-day. When I'm busy doing patient care or attending meetings, going throughout the hospital, I rely on them to watch my patient telemetry strips, so they're interpreting my rhythms. They're monitoring to see if my patient's vitals are within normal limits. They're alerting me if something's out of range. So they have a lot of responsibility as a young airman, which I think is great for them. And it's great for me too to know that I can trust them to be able to watch that and alert me when something's not right.
Patient safety is very important in dental due to the fact that the majority of the procedures that we do here are irreversible procedures. What we do to prevent any type of mishaps is we do a timeout before we begin on any procedure. So first we verify the full name and date of birth, the tooth that we're working on, as well as the procedure that we'll be doing. Then the doctor has to mark the tooth. And then last, we just have to do all three of those things again before we can begin.
Patient safety is a shared responsibility among all staff, whether active duty, civilian, or contract. By ensuring patient safety, we lower risks of negative outcomes which could occur in any of our surgical operations areas. For instance, with medication, we are always verifying the 5 rights of medication administration. Right patient, right drug, right dose, right route, right time. This is just one of the many ways we are providing patient safety here in Surg Ops.
Just like you heard, we encourage you to be a patient safety hero, anytime, anywhere, always.